name. Did you know? Always a right-hand man. Did you know he's gonna make it clear? Did you know? Come on, listen here. Did you know?
Hello and welcome to the Did You Know Show. My name is Brian Green, and today's show we are really happy and excited to feature Spectrum Health. With me today, I have three of the leadership team here today, and we're going to talk all about Spectrum Health and all the different services that they really offer around the city of Philadelphia. So with me first, I have Veronica Hill-Milbourne. She is the president and CEO of Spectrum Health. She is a federally qualified health center serving Philadelphia's most vulnerable for more than 55 years. Ms. Hill-Milbourne is a graduate of Villanova University College of Nursing. She holds a master's degree in health education from St. Joseph's and a Juris Doctorate from Temple University's College of Law. Wow, a nurse and a lawyer. As a registered nurse for more than 35 years, Ms. Hill-Milbourne has devoted her career to developing and leading home and community-based programs and services. She is passionate about community services and has been an advocate for health equality and social justice in traditionally underserved communities of color. With us also is Dr. Akila Muhammad, serves as the Chief Medical Officer for Spectrum Health Services. She is a board certified in family medicine and a graduate of Penn State University Medical School. She has practiced in medicine for more than 15 years. Dr. Muhammad has been a champion of health equality in predominantly underserved communities of color throughout her career. Also joining the conversation, very excited to have my frat brother. Dr. Everett A. Coleman Jr. serves as the dental director for Spectrum Health Services. Dr. Coleman is a graduate of Howard University and holds a doctor of dental medicine and a master's in public health from Harvard University. Dr. Coleman has practiced dental medicine for more than 45 years and is now leading the medical dental integration program at Spectrum Health. He is passionate towards educating the community about good dental health and its impact on total wellness. Okay, without further ado, Veronica, I'll start with you. Tell me about Spectrum.
Well, Spectrum is a federally qualified health center. We've been serving the Philadelphia community for over 55 years.
Oh, wow.
And, I think that what we offer to the communities that we serve and our mission here at Spectrum is to improve the health conditions and to advance health equity in communities of color, those communities where there is a high risk. And we're very passionate about the work that we do.
Wow, so where is Spectrum located? I know we have multiple locations, but we're in West Philadelphia, but tell us where Spectrum is located.
We currently have 3 locations. Our largest health center is at 5201 Haverford Avenue in West Philadelphia. We also have a health center at 1325 South 33rd Street in South Philadelphia and 1415 North Broad in North Philadelphia. We will be opening up a satellite next month at the Consortium at 451 South University Avenue and a 5th health center in the Northeast later this year. And that location is 7300 Frankfurt Avenue, and we know that that's a great opportunity to serve more people.
Dr. Muhammad, what services do you offer at Spectrum?
Yes. I would like to first say thank you, Brian, for inviting us to your show.
Oh, wow.
And to give me an opportunity to showcase a health center that I am truly proud of. It is the services that we provide that makes us who we are. Our model is focused on preventative care, and we pride ourselves on the integrated care model in which we offer services ranging from primary care to dental care. We offer a full spectrum of care, so to speak, that addresses the whole individual from their mental health to their physical health. Some of those services include, but not limited to, behavioral health, dietary services, prenatal care, HIV. Everything that a patient needs is in one place, a one-stop shop, so to speak. For the most part, our patients do not have to go anywhere else to fill their prescription because we also house an in-house pharmacy at our flagship site. And we are able to provide these services to everyone regardless of their ability to pay.
Wow, Dr. Muhammad, what makes Spectrum Health unique from your perspective?
So there are several things that I believe make Spectrum Health stand out. Our employees, for one, are extremely passionate about working here at Spectrum and serving the disadvantaged population. Many of our employees are from communities such as the one we serve. I, for one, was born in West Philadelphia, grew up in North Philadelphia, completed my undergrad at University of Pennsylvania, which is in West Philadelphia.
Right.
So we understand our patients' perspective because many of us have walked in their shoes. We also have medical providers, physicians, and leadership team who look like the patients we serve. So it matters to have representation. And not only do we have healthcare providers from diverse backgrounds, our providers also come from some of the best institutions in the country, and they chose to come here to serve this community.
You know, it's interesting, as I'm listening to you and I've read your bio, I too am from West Philadelphia and have family riddled all over Philadelphia, but mostly North Philadelphia and Germantown. So when you said that, it does make a difference, and a lot of people are really weary to come out of their community. The more and more I talk to people, it's interesting. When you talk to people that are from West Philadelphia, they're West Philadelphia.
Yes.
When you talk to people that are North Philadelphia, they're North Philadelphia. You know what I mean? Right. So, you don't go out of your community. I remember growing up, my one grandmother, to come down to Center City was a big deal. And so, when you talk to people, what I like about and what I've learned about Spectrum Health, you kind of meet people where they are.
Yes.
And I think that's really, and that radiates. When I come through here, you can tell this is about the people. Dr. Coleman, my frat brother, from Howard University, and we had a talk off screen, Alpha Chapter. And for those that follow the show, you know that I am a member of Omega Psi Phi Fraternity Incorporated. Okay, we just had to get that out there. Shout out to the Qs. But Dr. Coleman, why is dental health important?
Dental health is important because most people feel that the mouth is over here. Okay, it's connected to your body. You have more bacteria per square inch in the mouth than any other place in the body. We're connected to the entire body. So oral health is total health. When you breathe in, you're actually bringing in more bacteria, and it goes to your lungs, it goes through your heart, it goes to every place in your body. And we can diagnose, and you have some symptoms sometimes that will let us know of underlying diseases that before the physician even sees it. Certain things like diabetes, certain things like autoimmune diseases, HIV. There are a lot of things. And then we also can look at certain medications that cause problems. And we can have to call the physician and say, look, this is causing certain problems. So when we talked about oral health, we are also very passionate about medical dental integration. In other words, if we don't work together for the total health of the patient, then that does not work. We also have ways of eliminating those type of diseases by just basically making sure that our patients have education. We have to make sure that they know that this is important, and we have to make sure that we show them how to prevent it. But like I said before, oral health is total health.
Wow, Dr. Coleman, tell me about your dental program here at Spectrum Health.
It is community-based. Now, before I had a private practice in Center City.
Okay.
For 30 years.
Center City, Philadelphia.
Center City, Philadelphia. My practice did not lend me to service a lot of the community just because of the expenses and, dental care and whatever. So when I had this opportunity, I jumped at it. It gives us a way of serving the community. And our program is, one thing good about FQHCs is that we're not profit motivated. Okay, so therefore, we're looking at the individual patient. We want the patients to feel like they're the most important person in that room. We want the patients we serve the patients with respect. We're professional at all times, and we want to make sure that the patient needs are met. We take care of their primary concern first. A lot of places you'll go there, or you have to have the exam, you have to do that, and they're coming out with their face out to here. You take care of that, what they need first. Yeah. After that, Then we educate them and say, look, do you want to have that again? No. Okay, well, this is what you need to do. Okay, and then we make an appointment for them. We make sure that we confirm them the night before, and we follow up. And we're trying to get the entire community on just one basic care level. And anything that we cannot provide, we have referrals to specialists. We follow up and make sure that they get it done. And then we make sure that they are on a certain maintenance level so that we can continue to watch, what's going on. Dental disease is continuous. Just because you're great today doesn't mean you're not going to have a cavity tomorrow. If you stop brushing your teeth for like 3 weeks, then you're going to know it. So we have to monitor them, monitor. So it's not only just prevention, it's not only education, but it's the, recalls also, and making sure that you follow them through the entire system.
If you just tuned in, my name is Brian Green, and welcome to the Did You Know Show. The Did You Know Show is centered around connecting people to home, community, and business resources that you ordinarily wouldn't know about. And the interesting thing is that, I am from West Philadelphia. I do business in West Philadelphia, or in the city of Philadelphia, and I didn't know very much about Spectrum Health. And I was invited to a panel discussion in early April of this year. And anyway, through that conversation, my co-panelist at the time was Veronica Hill-Milborn. And I was just blown completely away about the services here at Spectrum. And as we sit here in West Philadelphia, 5210 Haverford, we're sitting in what is now was described to me as a new pediatric wing. Yes. And the building, the staff, whether they are operations or IT or medical or administrative, have just been so welcoming. I was just blown completely away because normally, and I'm not knocking any of the major health systems, but normally that is not the experience, unfortunately. And a lot of the health systems are now geared to community and diversity and inclusion. But inclusion is, again, something being inclusive of everybody. Okay, let's take a quick break. When we come back on the other side, we're going to talk about the health disparities in the community and what you guys see as stretch goals, really, in some pride in health to the community. So stay tuned, don't go anywhere.
Always Best Care specializes in helping seniors who wish to remain in their home but need assistance. Our flexible care programs vary from hourly to live-in. Simply put, we're there when you need us. And Always Best Care is an approved Community Health Choices provider. Call today and we'll meet with you to develop a personalized care plan. Always Best Care Senior Services, doing more, caring more, and dedicated to exceeding your expectations. Always.
Always Best Care is a great place to work. Flexibility,
leadership, purpose,
great benefits.
There's never a dull moment.
Diversity, inclusion, compasión.
We love our jobs. If you're looking for a great place to work, you can join our compassionate Team Green. You can apply online at teamgreenabc.com or call 267-909-9248.
Teamwork makes the dream work.
Did you know?
Welcome back to the Did You Know Show. We're here today at Spectrum Health, and we're having a really, really uplifting conversation and really informative. And I really wish, as with most shows, you guys could really see what we're talking about when the cameras go dead. But as we come back and we rejoin the conversation, Dr. Muhammad, I'll start with you. Do you see health equity concerns within the communities served by Spectrum?
Absolutely. And health inequities is something that is pervasive in the community that we serve. I believe that I know that it stems from the long-standing systemic and structural racism that exists in our nation. Mm-hmm. The communities we serve have a high disease burden resulting from the health disparities that exist. And the health disparities in our community are manifested by the high rates of diabetes, high rates of heart disease, even the children with high rates of asthma in the city, and most recently, the high rates of COVID-19 in our community.
And Dr. Coleman, what do you, same question to you. You know, the health equity concerns within the community served by Spectrum, how you approach that?
Well, just making a comparison between when I was working in Center City with a different type of practice, and here, the severity of the dental disease is much greater here. And when I talked earlier about trying to take care of the initial or the primary need of the patient when they first come in, that's what they want. But then afterward, you try to make sure that they understand that it can be prevented. You know, and a lot of it is just is education. A lot don't realize that, oh, this is caused because of. You know, we have kids coming in with like 5 and 6 cavities at 6 years old. Oh, and then, you know, eating candy every day and telling the patient, telling the parents, say, look, why don't you try fruit or something or snacks or something? And they don't realize that sugar is what's really killing them. Baby bottle syndrome. You know, you don't give an infant a bottle before they go to bed, because the acidic acid, the acid in the milk will cause cavities. I mean, there are a lot of things that happen that patients don't understand. And like I said, the parents and the patients. So we work on the kids, and then we try to get the parents to come in and whatever, and then daddy and grandma and everybody else. So but like I said, it's not just because of the amount of dental disease, but it's the severity.
Just to spin on a question, Veronica, and I'm sitting here and I'm thinking to myself, one of the things that probably this team has to deal with being in the community is people are fearful, and myself included, of being health shamed. You know, you really don't bring about a lot of questions sometimes because you're fearful of being health shamed. Like, you know, when you talk about, like, oh, diabetes, oh, congestive heart failure, oh, high blood pressure. And, you know, and people are forced to kind of live within their means, and oftentimes that doesn't drive them out of the community, and sometimes they can't because of, you know, health disparity and social equity and racism and all that kind of things. You really don't sometimes get a chance to really ask the question that is on your mind. I have to think that as an administrator, when you do not a survey monkey, sometimes more of a poll, when you're talking to your health administrators, when you then take it as a practice and a credo, we care, we value, we serve, how do you administrate that?
So, you know, one of the things I'm so proud of is the people that work here at Spectrum. I tell people that you don't come to Spectrum to get rich, but the providers, the doctors, the nurses, the social workers, the nutritionists, the entire team, our front desk patient service receptionists have patient service as part of their DNA. So we always create a warm and welcoming feeling to those that walk through our doors, recognizing that, you know, patients come with multiple health conditions, financial challenges, mental health. I often say that in the last data poll that I looked at, 25% of the people that we serve have some mental or behavioral health diagnosis. So we built an entire mental health team of behavioral health consultants, psychiatric nurse practitioners, to work alongside of our primary care providers to address the total patient. And so we provide, as Dr. Muhammad mentioned, an integrated approach. The other thing that I think is important to mention about Spectrum, because we are a federally qualified health system, we don't turn anyone away. We accept all insurances, Medicaid, and if you don't have insurance, you can still receive services here. We will develop a sliding fee schedule and base our payments based on your ability to pay. So there's no reason why people cannot access the needed supports and services. And another thing that is important as we respond to the health equity issues is access. And so we have been providing telehealth since March of 2020, which has made a big difference in the lives of the people that we serve. It removes all of the barriers. You know, our providers are available via internet, video chat, or regular telephone. We often say that, there's no reason you can't access your provider.
That's very important. And as I'm sitting here, I'm just thinking about my short experience with, they say first impression is the last impression. From the time I walked in this door, they didn't know who I was.
Yes.
They didn't know what I came for. From security to the patient service rep, everybody was like, "Come on in. What do you need? What is your deal? Oh, okay. You with the TV crew today? Fine. Fine. What have you?" But it was just like I was just like, "Oh, okay." I felt at home. I felt at ease.
Yes.
It was just welcoming,
Yes.
which is awesome. Sometimes when you walk into a facility, sometimes you feel like, "Oh, I gotta start." You're met with, "What insurance do you have?" Your copay is $30. Before you see anybody.
Before you say the name.
Before you even say your name. That I gotta be honest, that was not my experience. I knew I was coming here to feature through the television program of Did You Know? But just walking in, I thought to myself, I'm not a patient, but I'm coming here to talk about what the patient services and experience is like. And Dr. Muhammad, you briefly mentioned the health disparity, but dealing with COVID, which is our current events, right? We've gone from being able to access COVID tests, to now convincing people to get vaccinated, which is a strange way because for our community, for the Black and brown community, because of the history of the health systems, we're not always as trusting of the health system, and so now. We had a lot of success in getting folks tested, but now we're moving on to getting people vaccinated. And so from your perspective, and again, everybody chime in. I'm going to start with Dr. Muhammad. What have you seen? What has been some of the conversation that you're hearing from the folks that probably are not in a hurry to get vaccinated?
Yes.
What are you telling them?
So I am a physician and I interact with patients every day. So of course I hear a lot.
Right.
But vaccine hesitancy is a complex but critical issue, especially in our community. We all know that COVID-19 has hit our patient population the hardest. African American have the highest rate of hospitalization, deaths from COVID. There's a lot of misinformation. We can't forget the distrust, the mistrust in the healthcare system that also is confounded in patients' hesitancy. I, as a physician, especially coming up in this community, I have family that come to this health center. I have conversation, roundtable conversation, and some individuals, they look up to me as a physician, a trusted individual. And they went ahead and got vaccinated. There are others who still contest. We have these debates back and forth. But I believe the key is, as Dr. Coleman had mentioned for dental, is education. Education and
From a trusted source.
from a trusted sourse.
Getting the facts.
Yes.
Forget all of the rumors.
Exactly.
Look at the data, get the facts.
Get the fact. And I saw patients yesterday, and there was actually two patients who are now fully vaccinated who actually, they came in for another reason. They just said, "Dr. Muhammad, I just want to thank you. Thank you for convincing me." They actually said convincing me to become vaccinated. And so we had the conversation, and I was just curious, just to understand, a patient's thought process, like what is it? Why, how did I convince you? And so, our patients, they're really, really sick. I had one individual who suffers from blood clot, and understandably so, with, the whole issue with one of the vaccine manufacturer, small incidence of blood clot, small but serious incident. And I just, heard the patient. I just listened to the patient, acknowledged his fear, and then I gave the facts.
Right.
Simple as that. Gave the facts. And then he proceeded and asked, "Well, Dr. Muhammad, do you think that I should get vaccinated?" Of course I said yes. And he said, "Doc, I trust you." He went downstairs that very same day and became vaccinated. And mind you, he declined well before COVID, he declined vaccination, just because he just didn't trust in the vaccine. So I thought that was very interesting that he decided to go down there because he said he trusted me.
You know, it's interesting. As I mentioned earlier in the show, Veronica and I were on co-panelists on this, on a broadcast for the Word radio station. And anyway, she gave a real approach that that has not left me. You know, with a lot of the vaccination hesitancy, it's funny to even hear it that way, but that's what it is, right? Yeah. The hesitancy involved, you know, and I too have those conversations as an employer, as a leader of my organization, you know, as an administrator, and you know, we've gotten guidance from EEOC as well as OSHA, and they're leaving it a lot of times up to the employer to deal with it. So, you know, it's no secret that you know, my big company is the company that I'm for profit. You know, we're in the home and community-based service space, right? And so then, you know, now, before it was this whole thing about getting access to tests and vaccinations, but then now you have to educate your staff and your village, if you will, because it's two-pronged, if you will. It's the caregiver and then also the actual consumer. But I'm interested, you know, Veronica, you know I wasn't going to have this show
without me telling that story.
Without you telling that story, and what you tell people, you know, as an administrator, as a mother, as you know, an administrator, as a person that leads many, why they should get vaccinated.
Right. So I'm a registered nurse as well, and I took the time to read the research and understand the science. So I'm making my decision and I'm advising people based on the science of what I know, not from what I've heard whispered down the lane.
Right.
And when I tell people who suggest that, you know, the vaccination and the whole push around vaccinating communities is a conspiracy. Well, if that were the case, why would we start offering the vaccine to healthcare providers? The last people you want to take out is healthcare providers, because if you're sick in a pandemic, you need your healthcare providers.
Right.
Also, this is just another tool in our toolbox. If everyone pursues vaccination, we can get back to some sense of normalcy. When you and I met this morning, you know, I said, I don't have on my mask because I'm fully vaccinated. You can take off yours. We can be free and have conversations again. And so we still want to do those same things of, you know, washing our hands frequently, social distancing when possible, but the vaccines are safe. Here at Spectrum, I was the first person to get vaccinated, and Dr. Muhammad was the second. So as leaders within our organization, we wanted to be out front to clearly give a message. We believe in this vaccine. It's what we should all do.
Okay. Well, you know what? Let's take a quick break. On the other side, let's continue our conversation about dealing with, you know, now we're vaccinating folks, we're educating folks, but I also want to talk about what we're doing in the community to encourage people to pass the message around to getting your health accessed. Stay tuned.
Did you know?
Always Best Care specializes in helping seniors who wish to remain in their home but need assistance. Our flexible care programs vary from hourly to live-in. Simply put, we're there when you need us. And Always Best Care is an approved Community Health Choices provider. Call today and we'll meet with you to develop a personalized care plan. Always Best Care Senior Services, doing more, caring more, and dedicated to exceeding your expectations. Always.
Always Best Care is a great place to work.
Flexibility,
Leadership, purpose.
Great benefits.
There's never a dull moment.
diversity, inclusion, compasión.
We love our jobs. If you're looking for a great place to work, you can join our compassionate Team Green. You can apply online at teamgreenabc.com or call 267-909-9248.
Teamwork makes the dream work.
Did you know?
Welcome back to the Did You Know Show. We're here today featuring the Spectrum Health, and we're getting so much information. And Veronica, I want to start with you. If you could just tell us again, you know, you guys are federally funded. You mentioned that you accept all insurances. But walk us through, if you don't mind, what it is when somebody comes down here in hopes of getting vaccinated.
So in order to receive the COVID vaccine, you need to have an appointment, although we do offer walk-ins. And to schedule an appointment, you can call our main number, 215-471-2761, to schedule an appointment. Or you can also register for the vaccine by going onto our website at www.spectrumhs.org. And there's a link at the top of the website to click a button to schedule an appointment, and someone will call you back within 48 hours.
How many people have been vaccinated so far at the facility?
Well, we're proud to say that we've vaccinated approximately 10,000 people.
Wow. And collectively, and I got one question too before we move on. What delineates whether I should go to the West Philadelphia location versus the other locations? Is there anything?
It's up to you. It's based on the closest location. So when one of our patient service representatives responds to your call or answers your call, they'll ask you which health center you would like to be scheduled at.
Okay. And so when you're talking about mental health in the community service by Spectrum, Dr. Muhammad, what services are you really talking about in general?
Yeah, so roughly 25% of our patient population suffers from a mental health diagnosis. And I would like to say that there are likely more undiagnosed patients with mental health, particularly since the COVID pandemic. And we currently have a rich integrated model in which we have behavioral health consultants, psychiatric consultants. We also have case management, and we are expanding and actively looking to hire more mental health practitioners for our patients.
And Dr. Coleman, you got me together on the break. I made a mistake. You're the dental director for the Spectrum Health Services,
Yes.
but you came out of retirement to come here and lead the dental department.
Yes.
So tell us about that role.
Well, as you stated at the very beginning, I have a master's in public health also.
Okay.
And I've been a consultant for 30 years with the Department of Labor. I administered the dental program at the Philadelphia Presence for about 4 or 5 years. And this gave me an opportunity to use my administrative skills in public health as opposed to seeing patients. I was a full-time dentist downtown. But what it gave me an opportunity to do is to bring those concepts of private practice into a clinical setting where you can actually be of service to the patients, as well as I have dentists under me that I'm mentoring and trying to groom them into looking at the patient and not at, I hate to be so crass, at the dollar, okay? Right. And you know, being a true practitioner and a true healthcare provider, as opposed to just looking at the mouth and saying, okay, I'm gonna do this tooth, you know, it's looking at the total patient. We talked about fear a little bit before, fear of the COVID, but you know, people fear the dentist more than almost anything.
I get really stressed out when I gotta go.
I could be, yeah, I could be, let's say I could be at a cocktail party, and then, you know, you're meeting someone and you say, what do you do? You know, what do you do? I say, I'm a dentist. I say, oh, I'm gonna go and get some punch. or they say, I had it, you know, you're giving advice or whatever, but there is a big fear of dentistry. So I have to make sure that our dentists understand how to calm the patient down. We also, with 25% of our patients having some kind of mental whatever, that's another layer on top of that, that I have to teach my dentist how to deal with that also. So I mean, it's invigorating to me to be able to have this opportunity to do that. And we have a great facility. We're opening another, we're going to have dental services in the Northeast facility also. And, you know, I'm excited to be here and part of this team.
And they work together, so our medical providers and the dentists work together to address the patient's total needs. So that you will see them often collaborating in the hallways together, or if a patient is seen by one of our medical providers and the patient's been identified as having some dental health issues, they just walk them over to Dr. Coleman and the team, and they're there to embrace them.
We take a blood pressure on everybody that comes in.
And then he calls me, hey.
You know, if they're, or if they have some kind of a medical problem there, I mean, that medical team's down there in 2 minutes.
Yes.
Okay, there. I mean, it's just like that. So I'm in a situation where I know all of the patient's needs are met, not just dental, and we can focus on that and not worry about it. You know, someone came in with a blood pressure, we couldn't get the top number, and the bottom number was like 130. You know, we're not working on you today. I don't care what you have. You're going upstairs. You know?
Dr. Coleman and Dr. Muhammad,
yes.
I want to ask you, I mean, we've been talking, the conversation has been focused on Spectrum Health, right?
Yes.
But I want to just switch it just the focus of it, and I want to ask both of you separately or together. When you see the young doctors, be it a woman or minority or a person of color coming out, and they're kind of in a quandary whether to go into private practice or to work for a health system, what advice would you give a young physician coming out of residency, going into the health arena today? Because it has changed, I'm pretty sure. When I look at your bio, you've been around, you know, for more than 45 years. And in that time frame, I'll start with you. You know, what advice would you give somebody that is not only considering being a doctor or physician, but potentially being an entrepreneur?
When I graduated dental school, less than 5% of the patient population had dental benefits. Okay, they were of the mindset that, okay, well, if I want this, I have to, you know, pay for it. Over the last 45 years, it's almost like, well, what does my dental insurance pay for? Right. And so you find out that the patient population now has been educated to the point that this is covered, and that's only what is available and only what is, how can I put it, necessary. That's what I was looking for. Okay, this is what is necessary. So you have to, and you have to look at the person that's coming out and what is their motivating factor. An average debt of a dental student coming out of dental school is $250,000. How do I pay this off? Okay, and that's their prime concern right now. A lot might want to be an entrepreneur, a lot might want to do something else. We look for patient-centered individuals that are coming out. If a patient, if their driving force is that, oh, I want to have a nice BMW and whatever, and I want to get it tomorrow. No, you okay, you can pursue that. Most of that type of individual needs to just be an associate in a dental practice, and then try to come up with a scheme where he can become a partner after a certain number of years.
Right.
Okay. For those that want to deliver care and to enjoy just making the patient happy, then then they can come and see us. Okay. One advantage we have, though, is that we have a loan forgiveness program.
My loan's forgiven.
Yeah. So and you know, and it's a substantial amount that comes off for the number of years you work there. So that's the driving force when they come out, as far as just the debt for most of them.
It's a benefit to working for us.
So to be an entrepreneur and you go to a bank and you have $250,000 worth of debt, you're not going to get money to open up a practice also.
Right.
So the best way to do it is to find another practitioner that will take you on their wing, and then you can buy that practice while you're working.
Got it. And then Dr. Muhammad, and I want to go ahead.
Yes.
You got something on your?
No, because I agree completely with Dr. Coleman. You know, everything that he said is things that I've communicated to young doctors coming out. And in fact, So I completed my residency at the University of Pennsylvania in family and community medicine.
Okay.
And I'm still in communication with, they've asked me, to come and, mentor their residents. And so that program in and of itself is called family and community medicine. So those individuals, they, instinctively have that desire to service the community. So again, similar to Dr. Coleman, you have to assess their, their driving force. Like, what are their career goals? What are their objectives and goals? Some may say, I want to make a certain amount of money, servicing the community. And there are the rest that, are truly passionate about the plights in our community and, really want to change the trajectory of our healthcare system. I mean, it needs to be changed on every level, not just on the administrative or bureaucracy level, but on the individual patient-physician interaction. That's where I thrive the most, is that, one-on-one, just really getting to know that patient, really looking at that patient as a whole individual, not just your diabetes, not just your high blood pressure, and not a paternalistic viewpoint as take this metformin because I said so type of thing.
Right, and it's interesting. I asked that question before because, and I want to get to Veronica in a minute, but sometimes it's been my experience, because in my career, I've been an administrator on the health system side. And what I've seen over time, and I used to tell young people coming into the profession, I hope that you don't get cold to the patient, because sometimes you're forced to manage people's comorbidities, if you will, according to their means. And so, sometimes, you see somebody coming in that is indigent or ruled, they have all kinds of issues, but they don't have the means to support it. And so how do you send somebody home with a womb vac if they don't even have electricity or the knowledge to support something like that? So after time, you can see those patients over and over again. What tends to happen in some health systems is that you see the patient care drop off. Clearly, Veronica, that's not the focus of Spectrum Health. We care, we value, we serve. So it's refreshing to see, I don't know if it's proper to call it Spectrum Health System so much as, a community kind of a situation. Right. So your vision as an administrator is what? What is the future of Spectrum?
So Spectrum is here to serve, and so it's the service that we provide doesn't just end here within our four walls. We also have something called Spectrum Without Walls, where we are out in the community.
Okay.
We're providing health screening, we're providing education wherever there's a need. And I think about when the pandemic initially, came into this country and into the city, we were one of the first providers with tents outside of our health center, and we've been out there through the winter months and now into the summer. And when the vaccine became available, our team came together and we discussed how are we going to roll out mass vaccination events. And we looked at it as this is our opportunity to truly impact the communities that we serve, provide transformational care, because we know that the people that we serve are dying. Yeah. And we came together and we worked 6 days a week. And our COVID vaccination process is a well-oiled machine. People are usually not here more than 30 minutes. You come in, you're greeted by a patient service rep, you're checked in, you get some initial paperwork, screening to complete, you get your vaccine, you wait for 15 minutes, and you're out the door. Conversely to some of the other vaccination programs where people were waiting in line for hours and hours, that wasn't the case here. You were in and out. And it was a pleasant experience. And we check our patients, we collect satisfaction surveys, and I look at those surveys because that's important for me.
It's very important.
I want to know that the care we provide is quality. I want to make sure that everyone that walks through our doors are treated with the utmost of dignity and respect. regardless of their ability to pay, regardless of their sex, sexual orientation, race. Everyone is treated the same here. And we want to make sure that everyone receives what we refer to as a world-class experience.
I can tell you, first impressions are our last impressions. Again, people at the front desk didn't know that I was coming here to interview the administrators, and they didn't care. My experience just from the first greeting, which is oftentimes, people don't realize that is important. I have to really feel really comfortable to come in here and tell you what's going on with me and give you the whole, how can you diagnose me if you don't really know everything that's going on? And then people, common people that don't have medical degrees are fearful of being health shamed. One of the, transparency for me, I am a type 2 diabetic and I have my own health issues. And I had to come to a term of reckoning that I have to, trust my practitioners. I have to feel that I can come in, and what's important to me, because I am a busy businessman, that when I come in, if my appointment is 10 o'clock, I'm not going to be getting seen at 11 o'clock. I want to get in and get out. But at the same time, I don't want to feel that the conversation with my interaction with my doctor or nurse is rushed. Right. Or that sometimes you don't know the questions to ask. You don't know what you don't know. Right. And you do. You're right, Dr. Coleman. My experience now with my dentist is, and my dental hygienist. I had to make that. And I've been going to the same dentist now for the last 15 years. But that was a real hurdle in the beginning. Like, listen, I'm going to probably be a special case. And they hear that all the time. Be gentle. And I shook their hands like, I'm a special case. I don't like pain. I want to avoid pain. But I'm going to do everything preventative to make sure that the pain is not there. As we wind down the show, I want to make sure that we've covered everything. What are the hours of operation? How do you work in tandem for emergencies? Whether it's a dental emergency, whether it's a mental health situation, whether it's somebody coming here, whether it's pediatric or an adult care, because it sounds like it's a family situation, right? And you can see all of the actual, all of the services. And if you're looking at the bottom of your screen, you will see the website, you'll see the phone number. But what are the hours of operation?
So at our Haverford Health Center, we are open Monday through Friday, 8:30 to 5. On Saturdays, we provide telehealth only from 8:30 to 1. At Broad Street, we're open Tuesdays and Thursdays from 8:30 to 5. At Reed Street, Monday, Wednesday, and Friday from 8:30 to 5. And again, patients have the option to schedule an appointment simply by calling 215-471-2761, or they can also request an appointment by using our patient portal on our website, which is www.spectrumhealthhs.org.
That's at the bottom of your screen for my people that definitely call in to the show and ask me to repeat the number. So we made it a point to put that website at the bottom of the screen as well as the phone number. And then when we are coming here at the different locations, it doesn't matter what your zip code is. It doesn't matter what your income median is. With your specialty practices, I'm sitting here and I'm thinking that I want to call for fund the need. You are federally funded, but how does the village support Spectrum Health?
So when, if a patient comes and they don't have insurance, we have financial counselors. So we will help the individual apply for medical assistance. We'll help them to navigate through their health insurer to find specialty services. You also asked a question about emergency support. So we always have a dental and a medical provider on call after hours. So if there is a medical emergency, someone will respond within a 20 to 30 minute time frame.
Let's take a quick break, and then we'll come back. And when we wrap up, I want to also talk about the HR department.
Oh, yes.
What you're hiring, what you're looking for. So let's she got excited, right?
Yes.
Let's take a quick break, and we'll come back on the other side as we wrap up the show. We're going to talk about what we're recruiting for. Stay tuned.
Always Best Care is a great place to work.
Flexibility,
Leadership, purpose,
Great benefits.
There's never a dull moment.
Diversity. Inclusion. Compasión.
We love our jobs. If you're looking for a great place to work, you can join our compassionate Team Green. You can apply online at teamgreenabc.com or call 267-909-9248.
Teamwork makes the dream work.
Did you know?
Welcome back to the Did You Know Show. I want to remind the viewers that you can check me out on the radio on 96.1 FM or 900 AM on WRD Radio on Saturdays at 4 p.m. as we take the Did You Know Show live. The Did You Know Show is centered around connecting people to home, community, and business resources that you ordinarily wouldn't know about. Today's show has been sponsored by Always Best Care Senior Services. Check us out at teamgreenabc.com. And as we wind down our show, which has been full of information with Spectrum Health, thank you for coming on the show. But as we wind down, we have some stuff that we have to cover. We haven't. Dr. Muhammad, tell us about the HIV program.
Yes. So as a chief medical officer, I oversee the infectious disease program, which we primarily focus on two disease processes, HIV and hepatitis C. Our HIV program is growing. And as you know, like all other disease processes, HIV is unfortunately prevalent in our African American population, particularly the African American female and the men who have sex with men. Those are the population that are deeply affected by it. We also have primary care providers, two in fact, who also specializes in HIV care. And their approach, which is different than an infectious disease specialist who specializes in all infectious disease, is that they come from a community health primary care perspective, looking at the patient as a whole and not as HIV positive patient. We promote that. Our mission, our core values, the way we display attracts the patients.
Okay.
We attract patients because they feel that they're not stigmatized when they come here. They're an individual who will seek care from providers who care about them as a whole. It's just so happened that they have an infection that we can treat.
Okay. And then, Veronica, tell us more about the pharmacy program.
So one of the benefits of receiving care at a federally qualified health center is our 340B discount pharmacy.
Okay.
Patients can receive many of their medications at a fraction of the cost.
Oh.
So something that might cost $30 in a generic pharmacy might cost $3 here at Spectrum, just by being a patient cared for by one of our providers. We do have a pharmacy on site here in our West Philadelphia Health Center, but we're also contracted with CVS and a number of other pharmacies throughout the city. And in order to get that benefit, you have to be a patient of Spectrum Health Services.
Wow. So as we kind of wind down the show, we talked about the HIV program, the pharmacy. We've talked about Spectrum Health. We care, we value, we serve. It's a wonderful, wonderful facility. I can tell you, I can speak from experience. Just my first step into the building, everybody was friendly, and they didn't know who I was. And that first impression is my last impression. But as we wind down, if you want to join an award-winning team, you can look at the bottom of the screen, but then starting with Dr. Coleman, what positions do you guys have that are open that you're actively recruiting for?
At this point in time, we're looking for a public health dental hygienist.
Okay.
They are specially trained in public health, and for a facility like that, plus they don't need the direct supervision that a registered dental hygienist needs. In the future, we will need more people for the Northeast facility.
Okay.
That's dental assistants and PSRs.
Okay. And then Dr. Muhammad, and your department, you got so excited. I gotta let you know. Let us have it. Who are you recruiting for?
Yeah, so we're recruiting for certified medical assistants, nurses at all level, LPN, RN, Masters of Nursing, and case managers, patient service representative.
Okay. And so if you're interested in applying at any one of the locations, you can certainly go to the website, which is at the bottom of the screen. You guys offer, I imagine, this is your HR spiel, full medical, dental, vision.
Our benefit program is comparable to anything that you would find at a local health center, health system. Full medical, vision, dental. We offer tuition assistance, reimbursement, PTO, bank of time. It's a wonderful place to work.
Yes,
Wow.
yes it is.
Now, you kind of softly said, and I'm just curious, Dr. Coleman was speaking earlier about, obviously, with most college degrees, but then certainly if you're coming out of medical school, you're going to owe somebody some bread. You guys softly mentioned, if I heard correctly, loan forgiveness. So what does that mean?
As a federally qualified health center, our providers can apply for loan forgiveness through the federal government. And so it's an extra perk by working for a federally qualified health center.
Now, if somebody joins your team at Spectrum Health, do you see a lot of employees taking advantage of the physicians here? I remember when I worked years ago, when I worked for a health system, certainly, you reap the benefits of working and seeing your doctors and that kind of a thing. So you do have that.
We do have employees who utilize our health center for their medical and dental needs.
Wow. Thank you so much for coming on the show. Dr. Coleman, Dr. Muhammad, Veronica, who's a nurse, a lawyer. She gardens and cooks. She paints rooms. It's a notion she paints.
She decorates.
She knows about art.
That's funny.
You guys have really given us a lot of information. Definitely check out Spectrum Health if you're in the neighborhood. And I want to just say that the show has been brought to you by, of course, Always Best Care Senior Services. We provide in-home care primarily to seniors. If you're somebody that's had a hip, a knee replacement, a back injury, certainly feel free to reach out to Always Best Care. We are also recruiting nurses. It seems like the sign of the times, right? Per diem, RNs, LPNs. If you're somebody that likes to go out into the home and community-based services, certainly look us up. But we're here today at Spectrum Health, where their motto is "We care, we value, we serve." Their website is at the bottom of the screen. Check me out on Saturdays at 4 p.m. at 96.1 FM or 900 AM. Thank you again for coming on to the show. I really appreciate your time today. I've gotten a lot of information and really felt the warmth of the environment. Good luck with the new facilities and the new opening up. You guys have been wonderful. And don't be surprised if you hear from Dr. Coleman or Dr. Muhammad on my show, on the radio show, giving extended advice on whether your dental needs or then your medical needs. Thank you so much.
Did you know he'll help you understand? Did you know always a right-hand man? Did you know he's gonna make it clear? Did you know? Come on, listen here. Did you know